Now, I'm looking. Let's first even let's be a little bit optimistic. Let's look at the city centers, the urban areas, you know, the metropolis, where yes, you can probably get facilities that can, like you said, have high incidence of risk assessment and do what they need to do. But if you're now going to the rural areas, where you have more of the farmers, more of the hunters, more of the predisposition to being infected. So what do we do now?
What we do is what we're doing now.
Talk about this. Talk
about it and make sure that correct information is being given out there. I had mentioned earlier the risk assessment. In other words, even as a country, Nigeria, what is our risk? Yes, there have been suspected cases in Mali, suspected cases in Sierra Leone, but at least as at yesterday, only no confirmed case. All the cases has been found not to be true. Ebola in Mali and Sierra Leone. Okay. Yes, Lassa fever has been found in Sierra Leone, but right now Ebola has been confirmed by lab diagnosis in only Guinea and Liberia. So it is very, very important that we keep it realistic as we have the discussion. But then... So
it's not that we are frightening anybody, no.
No, it's not that we are frightening anybody, because we have to keep it balanced to make sure that the risk is appropriate. So at this point, it will basically be a hypothetical question. If, for instance, it gets into Nigeria, that will be the basis for this.
Yes, it's hypothetical, but we should still be prepared. I mean,
exactly.
Boy Scouts, always be ready, always be prepared. Now, but besides what we are doing, I mean, for medical personnel, how about the general populace?
For the general population, it is to know, first of all, that when one is taking care of an ill relative, you have to protect yourself. And remember, for Ebola, we are discussing body fluids.
Like sweat?
Yeah, sweat, saliva. Remember, they vomit.
Yes.
And all that, and people handle that. Therefore, wear protective gloves. Wear gloves, even though you're taking care of your own relation.
Yes.
All right, and then
your loved one. Yes, somebody.
And then let them be separated from the other members of the family. And most importantly, you shouldn't even be taking care of somebody like that at home. Immediately, that's why there must always be a high index of suspicion. Go to a health facility so that the health facility takes over. But then constant hand hygiene, hand washing has to be constantly emphasized.
At home?
At home and everywhere. When you've been to the hospital to visit a sick relation, you have to wash your hands. When you're taking care of a sick relation at home, you have to wash your hands. But then, even more importantly, for the community. Remember, it has to come into the community somehow. And that's where the matter of the bushmeat comes in.
Okay.
This may well be a good time to abstain from bushmeat.
No, but you're serious now.
Yes, I'm actually serious now, to abstain from bushmeat. And then our practices, burial practices in Ebola virus infection is very, very important.
I like that. Say that again.
Yes, burial practices.
Okay, some of these wash and drink.
Yes. Oh, no, we're not even saying get to the level of wash and drink. The practice really in when there's been an established Ebola outbreak and somebody dies, remember, it is a high case fatality rate. And so you notice that mourners and people that have come in contact with the dead body, because the dead body is actually very infectious. So mourners that have come in contact with the dead bodies end up coming down with the virus. So what actually should happen is that the burial of somebody that has died with Ebola should be immediate, and it should actually be done by people trained to handle such situations. And just to summarize it a bit, do not wash that body, do not embalm that body, quickly put it in. Do not touch. Yep, do not touch, do not wash, do not embalm, and always wear very, very good protective clothing, including closed shoes, in handling that kind of body, and quickly put it in a body bag, in a coffin, and then bury.
When you say quickly, that's as quickly as 24 hours?
You would go put it in a mortuary, would you? Because remember,
people do that. Yes, exactly. A lot of because they will say no. We have to wait to do this ceremony. We have to. So we should not. People should not be encouraged to actually keep.
When
it is confirmed.
It is confirmed Ebola. When, like now, for instance, in Guinea, where it's clear that there's an Ebola outbreak and that's going on and people are dying of Ebola, you wouldn't expect. If the standard things are done, that would be what is recommended.
Now, let's leave the morgue issue out of it for now. Let's begin to look at some of the things. Now, you mentioned the fact that we may need to at least cut down on our appetite, for bushmeat, or what we call bushmeat. Anyway, that is games from the from the forest and all that. What other things should we also watch out for in terms of diet, or in terms of interactions, in terms of social? What else do we need to look at?
It's important to understand that Ebola virus infection the transmission is by close contact, and close contact of body fluids of somebody that has the Ebola virus. So really, it's not something you can get. It hasn't been established. I can get it by aerosol, meaning you can breathe it in. No, it hasn't been established.
So if somebody's sneezing by your side, it's not like you will likely get it?
When you sneeze, part of your body fluid actually comes out. So that's why I said there has to be proper respiratory hygiene and what we call cough etiquette. People should cough right, all right, and don't share your. It's always been known. Don't share your germs. Just keep them to yourself. So that should actually be encouraged at all the time, more so at a time like this. And then I've also said that, yes, even though we do understand that there's that aspect of the wild animals and the antelopes, but in terms of prevention and control, there isn't really much we can do for that, apart from just don't come in contact as much as possible. Try not to come in contact with those wild animals and things like that. And for every meat or blood product you eat, because some people do eat that, cook it very, very well. And people handling it in the processing should always wear protective equipment, yes, and then cook them thoroughly, and hand washing cannot be overemphasized. But then, more importantly, in the prevention and control, we look at it in different levels. At the community level, like I've mentioned,
yes,
those burial practices, communities should be aware when such a thing comes in, and then begin to educate their people. And it is critical that we try to do away with myths and rumors, because they do a lot of harm at a time like this. Because remember, this is something with a high fatality rate, so there's usually a lot of anxiety. So people will come with all sorts of things. Some people have even said in Guinea that eating onions cures it, all sorts of things. And that can cause panic, and people even begin to do the wrong things. So communities must empower their people with the correct information. And then when people become ill, they go to hospitals. Hospitals should, as at now, begin to also get themselves empowered to take appropriate action. Unfortunately, there's no vaccine for now.
No, before we get to vaccines, because I think that is about the high end of it.
Yeah.
Before we get to vaccines, just like what you just said, I want to latch onto that. That hospitals should be prepared, should be like proactive. They should be getting ready to. Do we have anything like that happening in Nigeria? Shouldn't we be doing something like that now in Nigeria?
We should be doing, but like so many other things that go on in institutions, there may be policies and preparedness things that are going on. Because nothing has happened, really.
So nobody's doing anything yet?
We may be doing, we don't know. There may be things going on. Remember, these are in private organizations and all sorts of places. And like I've said before, as a standard, there are minimum as a standard. And I would imagine that, yes, in some settings, those things are already in place. Because I'm a public health physician, I personally do not believe that we should begin to prepare specially for only one particular thing.
Okay.
It's a waste of resource. It should be universal. It should be standard. But then if you then have cases, you can then scale up a bit or tone down depending on your assessed level of risk that you've seen. But in terms of universal precautions and protecting yourself and hand washing standards and all those other things I've mentioned, it should be there all the time. Yes, it should be the normal routine. But then, like you've mentioned, in the outskirts and in the rural areas where we don't even have water to drink, where people don't even have running water, where people hardly take a full bath in a day, I don't see how a health post or even a primary healthcare center in some of those places will be able to meet and maintain the levels we are talking about.